It's normal on occasion to go back and double check that the iron is unplugged, or worry that you might be contaminated by germs, or even have an occasional unpleasant violent thought. But if you suffer from OCD or obsessive-compulsive disorder, obsessive thoughts and compulsive behaviors become so consuming that they interfere with your daily life. OCD is an anxiety disorder characterized by uncontrollable unwanted thoughts and ritualized repetitive behaviors you feel compelled to perform. If you have OCD, you probably recognize that your thoughts and compulsive behaviors are irrational, but even so, you feel unable to resist them and break free. Like a needle getting stuck on an old record, OCD causes the brain to get stuck on a particular thought or urge. For example, you may check the stove 20 times to make sure it's really turned off because you're terrified of burning your house down, or wash your hands until they scrubbed raw for fear of germs. While you don't derive any sense of pleasure from performing these repetitive behaviors, they may offer some passing relief for the anxiety generated by your obsessive thoughts. Obsessions versus compulsions. Obsessions are involuntary thoughts, images, or impulses that occur over and over again in your mind. You don't want to have these ideas, but you can't stop them. Unfortunately, these obsessive thoughts are often disturbing and distracting. Compulsions are behaviors or rituals that you feel driven to act out again and again. Usually, compulsions are performed in an attempt to make your obsessions go away. For example, if you're afraid of contamination, you might develop elaborate cleaning rituals. However, the relief never lasts. In fact, the obsessive thoughts usually come back stronger, and the compulsive rituals and behaviors often end up causing anxiety themselves as they become more and more demanding and time-consuming. This is the vicious cycle of OCD. Now raise your hand if you've ever heard someone playfully say, "I'm so OCD," while organizing their desk or cleaning their room. In many ways, this is the equivalent of saying, "I'm such a cancer patient," because you feel like staying in bed all day. Or, "I'm so anorexic," because you choose to avoid dessert after dinner. OCD is a serious mental illness marked by high levels of anxiety and emotional distress. People with OCD might have cleanliness rituals, but they don't enjoy them. They keep things clean and organized because otherwise they will experience crushing anxiety. Then again, it's also important to remember that not everyone with OCD has compulsions related to cleanliness. OCD is what's known as a heterogeneous disorder. In other words, it manifests differently in different people. In fact, only a portion of individuals with OCD are afraid of germs or have compulsions related to keeping themselves and their world clean. Now, just because you have obsessive thoughts or perform compulsive behaviors does not mean that you have obsessive-compulsive disorder. With OCD, these thoughts and behaviors cause tremendous distress, take up a lot of time, and interfere with your daily life and relationships. Most people with obsessive-compulsive disorder have both obsessions and compulsions, but some just experience one or the other. Common obsessive thoughts include fear of being contaminated by germs or dirt, or contaminating others, the fear of losing control and harming yourself or others, intrusive, sexually explicit, or violent thoughts or images, excessive focus on religious or moral ideas, fear of losing or not having things you might need, order and symmetry, the idea that everything must line up just right, superstitions, the excessive attention to something considered lucky or unlucky. Common compulsive behaviors include excessive double checking of things, such as locks, appliances, and switches, repeatedly checking in on loved ones to make sure that they're safe, counting, tapping, repeating certain words, or doing other seemingly senseless things to reduce anxiety, spending a lot of time washing or cleaning, ordering or arranging things just right, praying excessively or engaging in rituals triggered by religious fear, accumulating junk such as old newspapers or empty food containers. Now, keeping in mind what we just learned, I'd like to clarify a few things. Although it may be hard to believe, you've likely encountered many individuals with OCD and haven't realized it. People with OCD are often able to hide or suppress their symptoms in public, especially if they're receiving proper treatment. There's also a group of people with OCD who demonstrate no visible compulsions, even when they're alone. Pure obsessional OCD, also known as pure O, is a subtype of OCD that involves compulsions that are largely performed inside the person's head. People with pure O often don't even recognize that they have OCD, since their symptoms don't resemble the more traditional depictions of the disorder. From the perspective of a quote-unquote healthy individual, the symptoms associated with OCD might seem absurd or even comical. The solution always seems obvious. Just stop washing your hands. Calm down. The stove is off, you don't need to check it again. Can't you just be realistic? OCD is not a personality quirk. It's a disease. If curing a chronic illness was as simple as just calming down, no one in the world would be sick. People with OCD have brain regions that are literally malfunctioning, making it difficult, if not outright impossible, to fight their disorder without treatment. Certain antidepressants can be used to recalibrate the brain and soothe some of the symptoms. And exposure and response prevention, or ERP, can help patients train their brains to respond less severely to their anxieties. Despite all of this, OCD is still a chronic condition that can follow you for your entire life. OCD and mental illness in general is still highly stigmatized and misunderstood. The best thing we can do is to stay informed and avoid relying on the often inaccurate media depictions of people with these conditions. Don't let this misinformation continue to harm the very real people struggling with this condition. Thanks for watching. Please hit the subscribe button and Thanks for watching. Please hit the like button and consider subscribing. And as always guys, keep seeking more.